goodness, doctor, I need some help. I'm so tired, thirsty, and I'm losing salt like crazy here. And I can't get rid of all this potassium.
Tired, thirsty, losing salt, and keeping potassium, eh? Sounds like you have Addison's disease.
Addison's disease? But my name is John.
Oh, you jokester. Addison's disease is a disorder of your adrenal glands, which sit on your kidneys. So your body is lacking cortisol and aldosterone, which leads your body to losing salt. You know how we're going to fix this?
Salt? Tons and tons of salt?
No! Fludrocortisone. Sexy name, huh? It's a mineral corticoid, which is a steroid. It mimics aldosterone and will help restore the sodium balance in your body, which will then help your kidneys retain more water. It's also going to help rid your body of potassium.
Doctor, you've got lots of patients today. Why don't you let me take over the patient teaching for the fludrocortisone?
Thank you, Nurse Nancy Fancy. I don't know what I would do without you.
So, first off, you're not on any thiazides or loop diuretics, are you? No, ma'am. Good. If you were, we'd be worried about you losing too much potassium. Speaking of potassium, I certainly hope you like bananas because you're going to have to try to replace some of the potassium you're losing from this drug. I love bananas. Terrific! Prune juice, raisins, and pears are also good sources of potassium. Also, I know you're craving salt, but you actually need to try to reduce your dietary sodium because this drug is going to help your body produce plenty. Got it. Lots of potassium-rich foods and less salty foods. What else? Well, just like all prescribed medications, you need to make sure you take this as directed. It's going to be an oral medication. If you forget your dose, take it as soon as you remember, unless it's within 12 hours of your next dose. If you miss more than one dose, please call us. Also, call if you start noticing swelling in your hands or feet, if you start suddenly gaining weight in a short amount of time, if you have any dizziness, joint pain, muscle weakness, headache, or if you feel like your blood pressure or heart rate is elevated. This seems like a lot to remember. Don't worry, we're almost done, and I can give you some written instructions if it will help. The only other topic I wanted to cover is that if you have any current wounds, or if you get any wounds while on this medication, they may heal slower than normal because steroids can reduce immune responses. Wow, that was a lot of information. It's amazing to know how knowledgeable nurses are. Thank you.
Doctor, we think this patient is in adrenal crisis. She's confused, is febrile, vomiting, and had a seizure on the way here. Her husband said she's decided to stop taking her corticosteroids.
Oh no! When you stop taking corticosteroids suddenly, the adrenal glands don't know how to work on their own anymore. Nurse, we need IV Solucortef stat.
Right away, doctor!
I think she's coming around. What happened?
You are suffering from an adrenal crisis, so we had to quickly administer a steroid, Solucortef. Have you currently stopped taking any medications?
Actually, I did. I've been on corticosteroids for my rheumatoid arthritis for so long, I just got sick of them.
We understand that a daily drug regimen is difficult to stick to, but stopping suddenly is very dangerous. It can even result in coma.
I had no idea. I feel so lucky that I got here in time. Is there anything else I need to know about this medication?
Well, if we have to continue to use the Solucortef for treatment, you'll have to get frequent eye exams and monitor your blood sugar because this medication can cause hyperglycemia. Are you aware that while you're on steroids, you should avoid people who are sick?
Yes, because steroids lower the immune response, so I have a higher chance of getting sick.
That's right. I'll be back a little later so we can discuss some strategies to help you cope with taking your daily medication.
Thank you, I really appreciate that.
Oh my God.
Hey, what's going on in here? I have asthma. Howdy, howdy, howdy.
I have COPD.
I have systemic lupus erythematosus.
I have poison ivy, mates.
I have inflammatory bowel disease. I have conjunctivitis. Arr.
I have severe allergies.
Whoa, whoa, whoa. You guys are making this way too easy. You all get corticosteroids. Yes, that's right. Corticosteroids for asthma and COPD because it reduces lung inflammation. Corticosteroids for poison ivy because it'll stop skin inflammation. Corticosteroids for SLE because it'll suppress inflammation throughout the body. Corticosteroids for severe allergies because it can lower allergic responses from the body. Corticosteroids for inflammatory bowel disease because it'll reduce GI irritation. And yes, you guessed it, corticosteroids for conjunctivitis because it reduces ocular inflammation. Nurse?
Yes, doctor. Now, to make it easy, we're going to cover the systemic effects of corticosteroid use. So everyone take out a pen and paper. These are the side effects of steroids in your system. Moon face, hirsutism, acne, gynecomastia and a buffalo hump, central obesity, extremity wasting and osteoporosis, striae, retaining water, increased blood glucose, loss of potassium, easy bruising, irritability, immunosuppression, and his name is Cushing Man.
It's the one and only Eagle Double G. Snoop Dogg. Snoop Dogg. Da 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 da. You know I'm mobbing with the D.R.E. Da 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 da.